Imagine finding out that the little pill you swallow every single morning, the one you trust without a second thought, has been changing the way your heart, your blood vessels, and your kidneys work every hour of every day. And nobody ever sat you down to explain it. Not really. You got a label, maybe one sentence from the pharmacist on your way out the door. If you take a blood pressure pill, the next 20 minutes might be the most useful health conversation you've had in years. My name is Dr. Thomas Grant. After 35 years practicing internal medicine and geriatrics, I retired, and I started this channel for one reason. I got tired of watching good people walk out of a doctor's office with a prescription in their hand and no real idea what it does. We're building something here. My goal is to reach 100,000 folks over 60 who are simply done being rushed. If that's you, you're in the right place. Today we're talking about 3 of the most common blood pressure medications in America. By the time we're done, you'll understand them better than most people who've been swallowing them for a decade. And stay with me, because near the end I'll hand you a simple tool you can use at your very next appointment. First, I want to give you a way of thinking I've taught patients for years. I call it the steady resident rule, and it stands on 3 plain ideas. First idea: the name on your bottle is a family name, not just a brand. Amlodipine, Lisinopril, and Losartan all lower blood pressure, but they belong to 3 different families, and each one does the job a different way. One relaxes the pipes. One blocks a signal that tightens the pipes. One blocks that same signal at a different keyhole. Once you know the family, you know the pattern of what to watch for. You stop guessing. Second idea: these pills are residents, not rescuers. A painkiller is a visitor. You feel an ache. The visitor shows up, does its job, leaves. Blood pressure medicine is different. It moves in. It works by living in your bloodstream at a steady level, day after day, keeping things calm and even. That's why doubling up when you're worried, or skipping when you feel fine, breaks the whole arrangement. Third idea, and this is the one folks forget: a side effect is a message, not a malfunction. Your body doesn't speak English. It speaks in swelling, in coughing, in dizziness. When one of these pills causes a symptom, that's not your body betraying you. That's your body mailing you a letter. The mistake is throwing the letter away unopened, or worse, suffering through it in silence for months because you assume nothing can be done. Hold those 3. The label is a family. The pill is a resident. The symptom is a message. Everything today hangs on that frame. Let's start with the one that fools the most people, because it looks like something far scarier than it is. Swelling in the legs and ankles. Here's how it shows up. By late afternoon, your socks are leaving deep red rings around your ankles. Shoes that fit fine at breakfast feel tight by dinner. Your legs feel heavy, full, almost waterlogged, and your mind jumps straight to the heart. You think the pump is failing, so you cut back on walking, which makes everything worse. That's almost exactly what happened to Eugene, a retired postal carrier up in Spokane. 30 years walking a route in every kind of weather, strong as an ox. His doctor added amlodipine to his routine, and within a couple of months, Eugene couldn't get his feet into any shoe he owned. He told his wife his heart was giving out. He stopped his evening walks. He had a grandson's graduation coming up that spring, and he'd quietly decided he might not be well enough to travel for it. Here's what was really going on. Amlodipine belongs to the family we call calcium channel blockers. Picture the arteries in your legs as garden hoses. This medicine loosens the walls of those hoses so blood flows in more easily, which is the whole point. That's how it drops your pressure. But the veins, the hoses carrying blood back up toward the heart, don't loosen the same way. So you get more traffic coming into the neighborhood than leaving it. Fluid backs up in the tiny vessels near your ankles and seeps into the surrounding tissue. Doctors call this peripheral edema, which is just a fancy term for fluid pooling in the lower legs. Now, could that swelling ever be something serious? Yes. Heart and kidney trouble can cause swelling too. That's the catastrophic version, and it's exactly why guessing on your own is dangerous in both directions. Eugene assumed the worst and nearly gave up his trip. Another person assumes it's nothing and misses a real warning. You can't tell the difference from your recliner. Your doctor can. The Cleveland Clinic and others have documented this swelling as one of the most common reasons people quit calcium channel blockers without telling a soul. And quitting silently is the real hazard, because your pressure climbs right back up while you feel like you made a sensible choice. So here's your move. If you're on amlodipine and your ankles puff up by evening, don't stop the pill and don't start rationing your water. Write down when it happens and how bad it gets. Bring that to your doctor. There are real options. The timing of the dose, elevating the legs, sometimes a different medication entirely. Eugene made that call. A few weeks later, he was back on his evening walks. He made the graduation. Now for the second one. And here I want you to flip a belief you probably hold. The dry cough. Most people, when a nagging cough sets in, blame the air. Pollen, dust, a cold that never fully cleared. That guess feels so reasonable that the real cause can sit right under your nose for a year. Frances was a retired church organist in Knoxville, played the same Sunday service for 31 years. One spring she developed a dry, tickling cough at the back of her throat. Nothing to bring up, just a scratch that wouldn't quit and got worse the moment she lay down at night. Spring, pollen, she figured it was her seasonal allergies. She tried antihistamines. She bought an air purifier for the bedroom. Her doctor even ordered a chest x-ray, and it came back perfectly clear. 8 months of broken sleep later, exhausted and scared something was being missed, she finally sat down in front of me. I asked her one question. When did you start your blood pressure pill compared to when the cough began? She went quiet, pulled out her phone, did the arithmetic. She'd started Lisinopril about 10 months earlier. The cough had crept in around month 3. She had never once connected the two. Here's the mechanism. Lisinopril belongs to the family called ACE inhibitors. They work by blocking an enzyme that normally tightens your blood vessels, which lets pressure ease down. But that same enzyme also helps clear out certain irritating compounds in your airway. Block the enzyme, those compounds build up, and the lining of your throat gets twitchy. Think of a smoke detector that's gotten oversensitive, going off at the faintest wisp. The cough isn't in your lungs, it's a chemistry change in your throat. We worked with her doctor to move her to a related medicine that doesn't trigger that reaction. Within 2 weeks, the cough was gone. 8 months of ruined sleep, undone in a fortnight, because somebody finally connected the dots. But I have to draw a hard line here, because there's a cousin to this cough that is not a nuisance at all. It's an emergency. If you're on an ACE inhibitor like Lisinopril, and you ever notice swelling of your lips, tongue, face, or throat, especially if it gets hard to swallow or breathe, do not wait. Do not call the office in the morning. Do not take an allergy pill and hope. You call 911. That reaction is called angioedema, deep swelling in the tissues, and it's rare, but it can close an airway faster than you'd believe. So burn this in. A dry cough is annoying and worth a calm conversation. Throat swelling is a 911 call. Same family of medicine, 2 completely different urgencies. Quick pause. If this is already making things clearer than anyone has bothered to before, do me a small favor and hit that subscribe button. We're trying to reach 100,000 folks over 60 who refuse to be rushed, and you joining genuinely helps. While you're down there, tell me one thing in the comments. What's the name on your blood pressure bottle, and how long have you been taking it? I read them. I want to know who I'm talking to, because the next one I'm about to cover surprises people more than anything else in this whole video, and it's hiding in something sitting in your kitchen cabinet right now. Here's the twist, and it's a good one, because the danger doesn't come from doing something wrong. It comes from doing something you were told was right. Losartan belongs to the third family, the one we call ARBS. Like Lisinopril, it works on your body's blood pressure control system, just through a slightly different keyhole. And one quiet effect of this family is that it can nudge your potassium levels up. For most people, kept in range and checked now and then, that's no trouble at all. But watch what happens when life adds to the pile. Hank was a retired diesel mechanic in Tulsa, the kind of man who fixed everything in his own garage. His doctor told him, like he tells half his patients, cut back on the salt. So Hank, being practical, walked into the store and bought one of those salt substitutes sitting right next to the regular stuff. The box said, "Heart healthy, low sodium." Sounded perfect. He shook it on everything. Eggs, soup, his evening popcorn. What Hank didn't know, what almost nobody reads on the label, is that most of those salt substitutes swap the sodium out for potassium chloride. So here's a man already on a medication that raises potassium, now seasoning every meal with concentrated potassium, feeling proud of himself for eating healthy. The two stacked up. He started feeling oddly weak in the legs, tired in a way sleep didn't fix, a strange flutter in his chest now and then that he blamed on too much coffee. Here's why this one scares me. High potassium doesn't always announce itself. It can whisper, a little muscle weakness, some fatigue, maybe a tingling in the hands or an off-rhythm heartbeat. And then sometimes, with very little warning, it climbs to a level that interferes with the electrical signals keeping your heart beating in time. That's the catastrophic version, and it can land someone in an emergency room. Hank got checked just in time. His numbers were climbing. We caught it, swapped the salt substitute for a different seasoning approach, and his strength came back. This isn't only about salt substitutes either. Those electrolyte powders everyone's drinking now, certain low-sodium broths, some meal replacement shakes, they can carry a real potassium load, and nobody thinks to mention them because they're not prescriptions. They're just things off a shelf. The American Heart Association has flagged this combination for years, and still it slips by, because the salt substitute gets marketed as the responsible choice. So your move is simple. If you take Losartan or a similar medicine, and you've switched to a salt substitute in the last year or two, read the ingredients. If you see potassium chloride, that's a conversation for your doctor, not panic, a conversation. The fix might be as easy as a different seasoning and a routine blood test. The fourth one walks in disguised as harmless because it sits on an open shelf where anyone can grab it. Everyday painkillers, you know the ones. Ibuprofen, naproxen, the pills you reach for after a long day in the garden or when your knee acts up. We don't think of them as real medicine. They're just something for the ache, right there next to the gum and the reading glasses. Doris was a retired bookkeeper in Cedar Rapids with arthritis in both hands and a stubborn lower back. She took ibuprofen most days, sometimes a few times a day, had for years. She also took Lisinopril for her pressure and a water pill on top of it. 3 things that, on their own, were fine. Together, on a hot week when she wasn't drinking enough, they ganged up on her kidneys. The mechanism here is different from the others. This family of painkillers, the ones we call NSAIDs, work by dialing down a chemical that causes inflammation. Trouble is, that same chemical helps keep blood flowing properly through your kidneys. So, when you take these painkillers regularly, you're quietly squeezing the blood supply to the kidneys. Now add a blood pressure pill that's already leaning on those same kidneys, and a little dehydration on a warm day, and you've got 3 hands pressing on one organ at once. Your kidneys don't care that one came from a prescription pad and 2 came off a store shelf. They only feel the chemistry. The catastrophic version is sudden kidney strain, the kind that lands you in a hospital and sometimes doesn't fully bounce back. Doris felt unusually wiped out, a little puffy, and her water output dropped off. We caught it with a blood test, pulled the ibuprofen, got her hydrated, and her kidneys recovered. She got lucky. Not everyone does. The frustrating part is how preventable this is. The National Kidney Foundation has warned about this exact combination for a long time. So your move. If you take any of these 3 blood pressure medicines and you reach for ibuprofen or naproxen on the regular for arthritis or back pain, talk to your doctor before it becomes a habit. There are often gentler paths, a different pain reliever, a cream you rub on the joint, physical therapy, heat. You don't have to grit your teeth through the pain, and you don't have to gamble with your kidneys. Usually, there's a smarter road. You just need someone to point you to it. And here's the last one. The one almost nobody has ever heard spelled out, even though it's caught more seniors off guard than I can count. It's not about the pill at all. It's about what happens to the pill when you get sick. Not seriously ill, just a rough stretch. A stomach bug with a couple days of vomiting, diarrhea that won't let go, no appetite, barely keeping fluids down. Or just a brutal hot spell where you sweat all day and forget to drink. Lorraine was a retired kindergarten teacher in Lansing, sharp and careful with her routine. She caught a nasty stomach virus over a long weekend, couldn't hold anything down for 2 days, and she did what she always did. Took her Losartan right on schedule, both mornings, like clockwork, because she was a responsible patient, and that's what responsible patients do. Here's the part she didn't know. When your body dries out, the same dose that was perfectly tuned for a well-watered system suddenly hits much harder. Your blood pressure can drop too far. Your kidneys, already struggling with the fluid loss, get more vulnerable. So there's Lorraine, dehydrated, taking a pill calibrated for a normal day, and by the third morning, she stood up and the room spun. She went down right there in her kitchen. She was lucky it was just a bruise. Think of the dose like a coat picked out for mild weather, perfect on an ordinary day. But the dehydration is a sudden cold snap, and now that same coat isn't right for the conditions. The medicine didn't change. The weather inside your body did. This is the gap I want to close for you. You should have a sick day plan before you ever need it. A simple set of instructions from your prescribing doctor about what to do when you can't keep fluids down, whether to hold a dose, when to call, what symptoms mean go to the clinic now. So your move is one question at your next visit. Ask, what should I do with my blood pressure medicine if I get a stomach bug and can't keep food or water down? It's one of the most useful questions you'll ever ask, and almost nobody asks it. Get the answer written down and tape it inside your medicine cabinet. Because the moment you actually need it, you won't be in any shape to figure it out from scratch. So let's pull this together. 5 things, 1 frame. If you take Amlodipine, watch for swelling in the legs and ankles by late afternoon and report it instead of enduring it. If you take Lisinopril, watch for that stubborn, dry cough and treat any swelling of the lips, tongue, or throat as a 911 emergency. If you take Losartan, mind your potassium and read what's really in that salt substitute. With any of them, be careful stacking everyday painkillers on top, and every one of them behaves differently when you're sick and dried out. The thread running through all 5 is the steady resident rule we started with. The label is a family. The pill is a resident, not a rescuer. The symptom is a message worth opening. Now, the tool I promised you. I call it the bottle audit, and it takes 5 minutes at your kitchen table before your next appointment. Line up every bottle you take, prescription and over-the-counter both. The painkillers, the supplements, the salt substitute, all of it. Write each one on a single sheet of paper. Then bring that sheet to your doctor and ask these out loud. What family does each of my blood pressure pills belong to, and what should I watch for with each? Is there anything on this list that shouldn't be mixed, including the things I bought without a prescription? What's my sick day plan if I can't keep fluids down? And if I ever get a side effect that bothers me, what are my options besides just toughing it out? This is the conversation your 15-minute appointment never has time for. So you walk in having already done the homework, and you make those few minutes count. A doctor handed a clear, organized sheet gives you far better answers than one handed a vague worry. I want to close with something that isn't strictly medical, because after 35 years I've come to believe it matters every bit as much as any pill. You are not a number on a chart, you are not a name on a clipboard, and you are certainly not a 15-minute slot to be moved through before lunch. You are a whole person, with a body that has carried you through decades, and you have every right to understand what's being put into it. You have the right to ask why. Why this pill? Why this family? Why now? And what exactly it's doing in there? You have the right to speak up about a side effect without being told you're just being difficult or too sensitive. Swelling, a cough, dizziness, that's information, and information deserves to be heard. And you have the right to be a partner in your own care, not a passenger. To bring your list, ask your questions, and expect real answers in plain words. Too many good people suffer in silence because they assume the medicine is the boss, and they just take whatever it dishes out. That's not how this works. Your voice is part of the treatment. The quiet endurance, the gritting of teeth, that isn't loyalty to your health. Speaking up is. One important note before we wrap. I'm a retired physician, and everything here is general education, not medical advice for your specific situation. I haven't examined you, I don't know your history, and nothing in this video should replace a real conversation with the doctor who knows you. Never start, stop, or change a medication based on a video, mine included. Always talk to your own doctor first. If this helped you see your medicine cabinet a little more clearly, do 3 quick things. Subscribe so we can keep this community growing. Share it with someone you love who's managing blood pressure, because this is the kind of thing that quietly keeps people out of the emergency room. And drop a comment telling me which of these 5 surprised you the most. Your body is talking. I'm just helping you listen.